Hello, educators and future nurse practitioner students. My name is Ramla, and today I will be going over how to synthesize all that we have learned and how to apply it to clinical practice. I want to begin by emphasizing the significance of our roles as future FNPs regarding colon cancer screening. A national survey by Preventative National Reports, Volume 24, revealed that the top factors in barriers to colon cancer screening were lack of education and lack of screening recommendation by primary care providers. What this means for you and I is that we have a direct responsibility as future FNPs to educate, screen for, and assist patients with colon cancer prevention and screenings. So, in the clinical setting, what we want you to do is to target high-risk groups. As we discussed earlier, the guidelines recommend starting screening at age 45. However, other than age, there are other factors that you want to look out for. So individuals who are at higher risk, such as those with family history of colon cancer and those with inherited syndromes, such as Lynch syndrome and familiar adenomatous polyps. You also want to include those people who have a poor lifestyle, such as those who are obese, who are smoke, who have poor diets, and have high alcohol consumption. Other risk factors that you want to keep in mind are those who have had a cholecystectomy, who have inflammatory bowel disease, and cystic fibrosis. Remember to ensure that these high-risk individuals are screened both earlier and more frequently. Next, you want to pay attention to your patient education and patient assessment. During your health assessment, things that you are going to look out for are unexplained weight loss, blood in stool, change in bowel habits such as diarrhea, constipation, abdominal pain, or cramping. In your patient education, you are going to focus on lifestyle changes, stuff like changing their diet to a healthier one, increased exercise intake, quitting bad habits such as smoking or overconsumption of alcohol. These are all things that you want to educate the patient on. Then, and you want to make sure you teach your patient the importance of early detection and screening methods. When you go into the screening methods, there are a couple things you want to keep in mind. Make sure you're telling your patients both the risks and benefits of the different screenings that are available. You want to keep in mind the non-invasive screenings and the invasive screenings, as well as their timeline. So, for non-invasive screenings, we have the guac-based fecal occult test and fecal immunochemical test, which is done annually. Then you have your stool DNA test or Cologuard, which is done every 3 years. And then you have your more invasive techniques of sigmoidoscopy, which is completed every 5 years, colonoscopy, which is every 10 years, and CT colonoscopy, which is every 5 years. So when your patient comes in for those screenings, you are educating them on the screening and you are making sure that you remember when to recommend and how frequently to recommend and remind your patients when to do these screenings. Now, I want to circle back to barriers in screening. So, like I said earlier, provider recommendation is the number one barrier. So you are going to remember to recommend the screening and you're going to remember to remind them when it is time. Have a good reminder and follow-up system to make sure your patients are both aware and reminded of the screenings. You want to also discuss and address any accessibility issues and barriers, such as insurance limitations, fears, reluctance, language or cultural barriers, scheduling conflicts, distances. These are all things you want to keep in mind and make sure you address. And then finally, knowledge gap is a big factor that prevents screenings. So make sure you are filling the knowledge gap. This is your responsibility. It is your job to make sure that your patient is thoroughly educated on this topic. Make sure you answer any questions about screenings and really have a patient-centered discussion about how you can best assist your patients to get both screened for colon cancer and how you can make sure it is easiest for them. Next, we will be quizzing you on what you have learned so far. Thank you so much for your time.